Hello, my name is Dr. Sanithia Williams, and today I'll be giving you an introduction to colposcopy. So what is colposcopy? Colposcopy is a method used to closely examine the cervix and vagina for pre-invasive and invasive cancer. Its objective is to identify areas with the most severe abnormal appearance for potential biopsy. Why is colposcopy important? Because cervical cancer is a potentially curable disease if caught early. In addition, pre-invasive lesions can be completely excised, thereby preventing the development of a cancer. Here you can see the R1 colposcopy clinic objectives. This video will focus on how to successfully set up the colposcope and perform a colposcopic examination. The general technique for colposcopy includes identifying the cervix using a speculum, application of acetic acid, typically 3 to 5%, examination of the cervix using the colposcope, and biopsies as indicated. Satisfactory colposcopic examination requires that the entire squamo-columnar junction be visualized, that all cervical lesions have been identified and fully visualized, and that cytologic and colposcopic impressions correlate. Acetic acid is used for the colposcopic evaluation of the cervix and vagina, though more frequently for the cervix. Its application helps clear cervical mucus. After application, areas of high nuclear density will appear white or have aceto-white change. This is seen in areas with CIN. Normal squamous epithelium demonstrate no change as they are sparsely nucleated. High-grade lesions in invasive cancer quickly turn white and persist for greater than 1 minute. Low-grade lesions or condyloma typically have rapid loss of aceto-white change. Because the acetic acid must penetrate the epithelium, it is recommended that it is applied to the tissue for at least 90 seconds prior to viewing. For keratinized surface epithelium, such as the vulva, acetic acid must be applied for 3 to 5 minutes for optimal results. Here you can see a cervix with aceto-white changes. Lugol solution is also used for the colposcopic examination of the cervix and vagina, but more frequently the vagina. Highly glycogenated cells, such as mature squamous epithelium, stain a deep black brown, whereas CIN and invasive cancer stain yellow because there is little glycogen stores. Lugol's is useful in helping to identify lesions that are often overlooked and to delineate abnormal areas. Here you can see the differences between the staining and non-staining areas on the surface of the cervix. This is a photo of a typical colposcope. After identification of the cervix and application of acetic acid, you start by turning on the device. The cervix can then be viewed through the eyepieces. The scope can be adjusted to the correct height and the view focus by adjusting the focus of the light and the distance from the cervix. The magnification can be increased for a more detailed look at the cervix. The green light filter can also be used to identify abnormal appearing vessels. Here you can see a video of the colposcope being turned on, then adjusted to optimize the view of the cervix. Notice how the resident increases the height and then draws the colposcope in for better visualization of the cervical epithelium. The magnification and green light filter are also used to optimize the viewing experience. In addition to a speculum, several other instruments are typically used when performing colposcopy and biopsies. These include an endocervical curette. When the transformation zone cannot be fully visualized, an ECC or endocervical curettage is typically performed. A tisular biopsy forceps. Multiple types of biopsy forceps are available, but these are the most frequently used. There are two sizes, mini and regular. An endocervical speculum, used to open and examine the endocervical canal. And a vaginal wall retractor, helpful in retracting redundant vaginal tissue. The American Society for Colposcopy and Cervical Pathology, or ASCCP, guidelines can be found online for free. These are particularly useful in Colpo Clinic for guiding clinical decision-making. They can be found under Management Guidelines. The ASCCP app is also available for download for Android and iPhone. Here are some helpful links. Happy colpoing!